Hello everybody! This is the follow-up video that last time I talked about my experience in the NCLEX RN examination that I took on May 26th, which is actually just last month. I did not check Pearson rule at all. The trick? No, the trick did not take me. I didn't want to have some sorrow because it showed that I didn't pass, or it showed that I passed, and then the unofficial result shows that I didn't pass. So I just do nothing. I did not do anything. I just came back home. I ate, I slept, I watched TV. I had plans every day until 4 days afterward. Yeah, okay. But I ended up to check it, but I checked with Pearson, with the program that I have to pay them $795, which it showed that I passed the test, and then afterward I checked the Pearson rule trick that also showed that I could not register for another exam. Okay, so now we talk about what were those questions that I have. First of all, I'm sure that everybody can tell that this is not American accent, this is not English accent. Okay, I am Asian. Of course, in Asia, we have our own language, and yeah, in my country we use Thai. I did not expect to get off from the exam room really quick because I must have to read a lot and understand a lot of things. So totally, I spent 5 hours and 5 minutes in the test room. For the first 2 hours, I think I could not even make to 60 questions. I first took the break. The time that I chose to take the test, it was 11:30. So you might wonder what next to me right there. Yes, this is what I carry to the test room, excluding another bottle of water and some more ice. It's like a lot of people might not really think about food. They might not get hungry, but no, that's not me. I'm the one who prepare for everything, because all we knew that who knows that we might ended up to be in the test room for 6 hours to finish the test before we knew that we passed or we failed. So that day, I packed my lunch, I packed my snack in this cooler. I have yogurt, I have applesauce, I have cereal with a little milk. No, I didn't have my milk. I just have the cereal. Like, I just pick it if I get hungry. So for the first 2 hours, I got under 60 questions, and I took the break. For all of the time that I was in the test room, I had a hoodie on me, I put the socks on. It came from, I got cold because of the AC and stuff, from also panic, right? But after the 4 hours, after the 4th hour passed by, no, I started to take the socks off, I started to take the hoodie off, and I already thought, damn, can I lift my legs up here? I started to get tired, like really tired. I already thought, please stop sending me questions. I'm so tired of this. I just want to have it done. I can take the test again in 45 days. Right now, I am so done. Please done with me. All of those 5 hours, yes, I think I got either 119 or 129 question. I got 14 SATA, select all that applies questions. I got 1 picture question. I got what is that thing? I forgot how to say that word. I got put into the order, I think, and I kept tracking about the select all the apply because I feel like from everything that people said, if you just be on the easy question, you are on the curve that you are falling down. You are not gonna pass it. So the paper or the board that I got from Pearson, it was the paper that I kept using for my tracking. I tracked the select all the apply that once in a while that I would get one question. Oh, I got one calculation, but it wasn't really pure calculation. It was hidden calculation that you needed to calculate inside that question, but they didn't ask for the number. They asked about what happened with that number. I got a lot of infant, like assess those babies. I got some maternity. I did not have burns. I did not have what is that? See, I already forgot that. See how good is that? Once you pass the test, you can forget something. Okay, I remember. Parkland, I have none of those. I didn't have to calculate the burn and the formula that you have to give to the patient. But guess what? I have lots and lots of prioritization, delegation, and assignment. The questions that for me, it's really hard. For me, they are top difficult question. Because in my opinion, in order to get those priority, delegation, and assignment correctly, you have to know about the disease. You have to know about what's going on with the patient right now and who you should delegate that job to. I have lots of teaching the patient, all types. I could not stress enough about how many things I have to teach the patient in the exam. I was thinking, yeah, right, education. We need to do that to the patient, but I'm not a teacher, right? Why I have to get all of these questions? What else I have? Chest tube. I did not get the cast, traction, walker. No, I don't get none of those. I don't get any of those at all. Some farm, yes, I got some. And this is one question that I don't know if how you're gonna think about it, because I think all we knew that there's some easy question, there's some difficult question, and you just don't know what would be your questions that you're gonna get in the exam. One question that I had that really brightened up a whole room for me, because I had no idea what was that disease. I was like, oh please, these should be the signs that I am on or above the passing line. It was the question about the infant, like newborn. I'm sorry, it's not infant. Sorry, I call it wrong. About the newborn assessment, and it was I don't even remember how to pronounce or spell it, but I will get the Wikipedia link of that one. I already take a note about it. I think it's like Tay something. Okay, whatever. The question asks about this is the disease that you have to talk to the parents of the newborn, of the infant. I don't remember exactly for sure. And then it asks like pretty much the definition of that question. So lucky me that it was just multiple choice, and I had to use the test strategy to cut off some of the answer choices, and then I got the answer correctly. Okay, so I took 2 breaks. I already finished my lunch. I already finished my yogurt. I went to the bathroom, and then I already saw the clock that say this is already 5 hours past. I already thought after this question, I'm gonna take another break. I could not do this anymore. I needed to at least use the bathroom, sit down, and be out of this room. Oh, I forgot to mention the Pearson Test Center that I went to. It was maybe 10 or 12 seats that everybody would be in the same room with partitioner that divide you to have your own space, to have some privacy. If I remember it right, maybe about 2 p.m. of the same day, it was one more girl that came to take the NCLEX RN exam. Okay, but here how special of me that day. I got a special room. It was a little corner of that test center. I was in that corner room. I was, a lot of things happen. I hope all these are the good signs. So after I saw the clock that tick tock and said this is 5 hours passed by, I took the last question. Sorry that I could not tell you that it was the question that I could say that I passed. I knew it or I had no clue. I only knew after I clicked the answer. The screen just shade off, turned to be blue. I was, oh my heaven. Thank you that it finally showed this. I didn't care anymore if I'm gonna pass or I would fail. I was too tired to do this, and that moment, I just left the room. No, I meant I raised my hand. So the, how can I call her? The staff, she saw me. She came to the room and she brought me out and she securely checked me with every process that is supposed to be. She even told me, oh, you have been here for a long time. I told her, yes, 5 hours. Get me out of here. And I drove another hour back home. Okay, I'm gonna post the link of that the question that I had, the disease that I had no clue, and maybe that would be useful for you guys who listen to me. I hope you study hard and don't forget that you could make yourself out of school. You can pass the test. If I am not American born, English is not my language. I use Thai. English is just the second language, and at my age, I already 40 years old. I graduated with bachelor degree of nursing and midwifery from Thailand in 1998. And right now, it's 2017, I passed the test. You is gonna be the next one who passed the test. Believe in yourself, study hard. Don't look too much about how anybody else study. Look at the way that you could do it and have it efficiently. Study is not just look at the book, read it, and don't understand anything. You have to understand it in order to go to the next chapter, go to the next question. It just wastes the time if you are not gonna understand anything and kept saying, oh, I kept study every day, 3 a.m. in the morning. I'm still here and fuck study. It's not gonna help, guys. You don't have to brag yourself to anybody. You can take a nap. You can go to a vacation if you study and you know what you're doing. Okay, I hope this is helpful, and we talk later sometime. I also got some interviews. Maybe next time we talk about interview, or we talk about how I study. I also have a group on Facebook that I study hard and gather everything together to be those article and photo albums. I'm gonna post the link down here on my information of this video too. Okay, have a nice day and hope to hear the good news from you soon.